So I think people who know me and watch me know that I try not to get too exercised over everything. Like if everything's a mountain, there are no molehills. But I will tell you that when I saw the Florida Surgeon General, a guy named Joseph Ladapo or Ladapo, doing an interview with CNN's Jake Tapper on Sunday, I got pissed off. Because let me go through what he said and then I'll explain. So if you have not been following the news, Florida is the first state to say we're not going to have any vaccine mandates when it comes to schools. That it's just going to be, you don't have to have your kids vaccinated for them to go to school. It's the first state in the country to approve of that. Okay. So Jake Tapper asked this guy, Joseph Ladapo, the Florida Surgeon General, about this. He says, before you made the decision to try to lift vaccine mandates for Florida, which obviously includes public schools, did your department do any data analysis? Did you do any data projection of how many new cases of these diseases there will be in Florida once you remove vaccine mandates? Seems like a reasonable question. Here's how the Surgeon General of Florida responded. Absolutely. So absolutely not. Because it's not you mentioned whooping cough. So there's this conflation of the science and sort of what is the right and wrong thing to do. So he goes through that. So he says, absolutely, they did a data dive. Then he says, they absolutely did not do a data dive. So Tapper follows up. He says, you're trying to lift the vaccine mandate in Florida, and your department and you did not even do a projection as to how this could impact public health. Ladapo says, what I'm saying is that it's an issue of right and wrong in terms of whether parents should be able to have ultimate authority over what happens to their kids' bodies. This is an incredibly ignorant statement. You are the lead public health official in the state of Florida. You are saying we are not going to mandate vaccines for anyone in the state, including for kids in schools. And you admit and take pride in the fact that you've done no data analysis, you have no sense of what the potential rise in illnesses will be. Are your hospitals equipped to handle that? Are you going to get other kids sick, kids who maybe are immune compromised or have other illnesses, other conditions? None of that. It is, quote, what I'm saying is that it's an issue of right and wrong in terms of whether parents should be able to have ultimate authority over what happens to their kids' bodies. Okay. It is not just that. Okay. I understand the point he's trying to make, but it is not just that. This is a decision that will have broad implications on kids, on the elderly, and on the rest of us. If no one is required to get vaccinated against anything, you're going to see a re-rise of illnesses, measles, mumps, etc., things that can kill kids. And not necessarily, let's say I don't want to vaccinate my kid and I send him to school, and a kid who, for whatever reason, because of allergy or whatever, is not able to get the measles, mumps, and rubella vaccine, just as an example. And my kid gets measles, but my kid winds up being fine. But he gives it to this other kid who is much, much sicker and has complications from that. It is not, we don't live in vacuums. We live in a world in which there is or should be some sense of communal responsibility. And at a minimum, I would expect the Florida Surgeon General, the guy who is in charge of Florida's public health, Joseph Ladapo, to, at a minimum, conduct some basic projections of what this could mean in schools or in a state with lots of elderly people. If you have a belief, parents should be in charge of their kids or people should be in charge of their own bodies, that's your belief. Test that belief and say, okay, I believe that, but how dangerous might this be? The idea that he takes pride in the fact that he's done none of that and it's an ethics issue. It is not an ethics issue. It is a public health issue. I do not understand this stuff. These have real world implications when we are abandoning things that we know work. We know these help either limit severe complications in the case of COVID vaccines, or in the case of other vaccines, polio, measles, mumps, and rubella, help us manage what could kill thousands and thousands of people, and now have been reduced to almost nothing. Now we're saying, okay, well, we're going to let it come back because it's all about what parents want to do with their kids' bodies. No, it's not only about that. And the fact that in a gigantic state, huge population state, one of the biggest population states in the country, one of the largest elderly population states in the country, the fact that we got this guy making calls on public health should concern all of us. Like I said, I try not to make everything a rant. You know, I think that that's pointless. And I didn't want to rant about this either, but this is outrageous stuff. No one should be okay with this. You should not look at that guy and be like, yes, we should not do any data collection or any scientific projections. We should just willy-nilly just throw open. No, nobody needs to get vaccines anymore. We'll just see what happens. That is dangerous to public health, period. All right, that's all I got for today. I ask you to do one thing. Hit that subscribe button for me. It gets you free content like this every single day, helps me grow as an independent news creator. Take care.